Hello, this is Dr. Clint Sexton, and today I'm talking about why you don't want what I have to offer, and why you don't want functional medicine, and why you don't want to change your diet or do testing and things of this nature. So with functional medicine, we're always trying to get down to the root cause of a disease process. And to do that, we need to consult with you. We need to run different types of tests to help us identify which systems are not working so we can get down to what the underlying issues are and then formulate a solution, formulate a program to help reverse the dysfunction and restore health. Okay, so that's what functional medicine does. But one of the things we need to do before we get into all of that is to figure out why you would want to do that, why you would want to get down to the root cause of a health problem. So I have patients that come in every day, new patients, and I'll ask them, so what do you want? What do we want to do here? And they'll say, well, I have IBS, and I want food testing, and I need some blood work, and maybe a stool test, and start listing off all these things. And I go, okay, so why would you want to do that? Well, I want to get rid of my IBS. And I'll say, okay, so explain your IBS to me. And so they may say, well, you know, the usual, maybe some gas, bloating, loose stool, some bowel urgency, things of that nature. And I'll say, okay, so now we've just described your IBS, but why are those things a problem for you? How do they affect your life? Okay, now we're getting down to why you're really here. And then they'll think about it and they go, well, okay, so maybe the bloating, I don't like the way it feels because my pants feel tight and it puts my attention on it and I can't focus on my work. Or when my stomach, hurts and I have pressure, I become more irritable and I'm less patient with my children or my spouse. Or there's an anxiety about, well, what should I eat? And is this going to trigger an event? And where will I be when that happens? Am I going to be near a bathroom? Or will I be stuck in rush hour traffic when all this starts to flare up? And these concerns, this is how IBS and the symptoms of IBS are affecting that individual's life. And those are the reasons. Okay, so you don't have that anxiety about being somewhere, not finding a bathroom. So you don't have that irritability that affects the relationship with your friends or your family. Or maybe because of this, you're not able to go out socially as much as you were able to. Those are the reasons someone would come here. Those are the reasons you need to identify for yourself, because that's your driving factor. Those are your motivators. That's what's going to make the difference for you, because you have to know why you're going through this. Now, once you identify that, then you do want what we have to offer. Then, now that we know what's driving you, okay, now let's make sure we're all on the same page. I can do my work to help you eliminate these issues so that it changes these aspects of your life and your quality of life. And that's really what we're doing. So again, what I do is I get down to root causes as to why you have the problem. But through communication with you, we would also need to identify your root reason or your root why as to why you would want to go through this process. Hopefully that helps and it just makes sense in terms of getting this whole process with the true understanding of what you're dealing with, and so we can make sure that you get what you want from this. If you'd like some more information on this, check out the blog.